Now we have our very important vagus nerve here, but we also have these remaining organs over here. So we have our urinary and reproductive system. And these are supplied by these sacral roots over here. And if you're going into like nursing or like, actually think physical therapy probably important too. But yeah, if you're going on to professional health or in graduate school, you should know these roots like S2 to S4 innervates the urinary system and reproductive system. Now, with kidneys and bladder, so again, diuresis is part of parasympathetic. So for sympathetic activity, it's not time to use the bathroom. So what's going to happen is that your bladder wall is going to relax. Now it might be like, wait, sympathetic and relaxation. Wait, does that make sense? But your bladder is right here, right? So do you want, if you don't want to urinate, do you want your bladder squeezing or do you want it relaxing? So you want to ease up on the pressure, right? Because the more pressure you have on the bladder, the more you have to go. So it makes sense that sympathetic activity is going to relax your bladder wall, and it's also going to pinch off that opening, or actually you have two openings, but it's going to pinch off the urethral sphincters. Why? Because you don't want that pee to leak out. You don't want urination at this point, so you're going to shut the doors and also relax the bladder. Now with parasympathetic activity, now it's go time, right? So now you're going to get diuresis. So the bladder wall is going to constrict, so it's going to get a little extra push because why? When it constricts, it's going to increase the pressure of the fluid inside your bladder. That's going to make it easier to push out that fluid into your environment. Now the urethral sphincter is also going to relax because now it's time to go, right? So you want to open up the passageways, let the floodgates open, and let things flow, right? So parasympathetic, and yeah, so these people are super parasympathetic because yeah, they let things go. I know it's really hard to find things that aren't super explicit with urination, but yeah. So they're super parasympathetic in those examples. Now, this is where it gets a little complicated. Actually, like toward the end of next semester, I talk about the female reproductive system, and there's a reason why there are more lectures on that because it's fascinating. It's super complex, but it's actually pretty amazing. So it's also complex with autonomic nervous system and reproductive organs. Now, one thing is that it's not with sympathetic activity and the female reproductive organs, you don't want blood flow because it's not rest and digest time, right? It's not feed and breathe time. So therefore, the blood vessels are going to constrict when you have sympathetic activity. And this is where it gets complicated. So whether you have contractions, increased contractions, or decreased contractions, it depends on which sympathetic receptor is is present in the uterus, or whether there's actually a baby in there or not. So whether someone's pregnant or not, then that depends. So you can either have increased contractions or decreased contractions, and it kind of makes sense. Like, okay, you want it to push out when you're ready to come to term, but you don't want to cause contractions prematurely and cause delivery or loss of the pregnancy before it happens. So this is why it's very complicated. Don't worry too much about the contractions part, but just FYI, that sympathetic activity in the uterus is pretty complicated. Now, parasympathetic, the blood vessels part is pretty easy. So now you're going to have increased blood flow to this because why? Maybe you're going to use these organs, so it makes sense to have more blood supply to that. So you have increased blood flow to the uterus, the cervix, the clitoris, so all these organs, because now it's like, okay, if you're choosing to use it, yeah, maybe it's time to deliver blood to this area because you're going to use that. And you also increase glandular secretions as well because, again, this is parasympathetic time. Now, the male's reproductive organs. Now, the male one is pretty easy. So, sympathetic nervous system, blood vessels are going to constrict. So the interesting thing is that, they're definitely different in their internal and external anatomy, but in terms of their autonomic control and blood supply, luckily both sets of reproductive organs work very similarly. So sympathetic, not feed and breathe time, you're going to constrict the blood vessels. But if you're a male and you're trying to maintain an erection, what's going to happen? Well, what happens during erection is that you have increased blood flow to the penis. So if you constrict the blood flow, then you're not going to get blood flow. So that's going to prevent an erection. So the interesting thing is that the sympathetic is going to decrease blood flow and therefore cause flaccidity. But parasympathetic, what you have is the opposite. You have, instead of blood flow being decreased, you have increased blood flow. And therefore, this is why parasympathetic activity is going to cause an erection if you have enough blood flow to the penis. Now, this is where it gets a little tricky, is that for sympathetic activity, it also does something else. It also causes ejaculation. So this is where it's kind of interesting. It's not quite a... So think of it this way. Would you rather, if you're a male and you... So would you rather be parasympathetic first or sympathetic first? So this is where it's not just about which is predominant, but also about timing. Hint 1, mission accomplished. 2 is kind of awkward. So you want it to go in the right order, because otherwise you might do something unintentionally before you actually want to do what you want to do. So yeah, little thought experiment and think about it this way. Which would if you're a male, what would you rather have? Parasympathetic first, then sympathetic, or sympathetic, then parasympathetic? And again, this is also why maybe some people get it mixed up, because you sometimes have both occurring in the background, and sometimes one overshoots the other, right? Yeah, so yeah, and doesn't it involve some SNS-like symptoms? And that's why sometimes I've heard of situations where, like from urologists, where they're so excited that it affects their reproductive organs. So they're so sympathetic, it's starting to affect their activity in the bedroom. So that's why you also get these things. Like sometimes it is in their head, because they're like, okay, maybe they're the wrong system, division of the autonomic nervous system is kicking in or being dominant at that wrong time.